Welcome to This Week in Otolaryngology. This week we're covering 10 notable papers spanning tinnitus management, advances in otology and neurotology, new data in head and neck oncology, and updates in rhinology and sleep medicine. Let's dive in. We begin this week with tinnitus, a condition affecting roughly 1 in 7 adults. A comprehensive primer in Nature Reviews Disease Primers provides a state-of-the-art overview of the condition. It reminds us that tinnitus is a complex process involving cochlear injury, central gain, and maladaptive plasticity, often modulated by stress and emotion. The authors reinforce that tinnitus-focused counseling and cognitive behavioral therapy remain first-line treatments. They also note the promise of emerging therapies like neuromodulation. On that very topic, a systematic review and meta-analysis in the laryngoscope evaluates the evidence for these approaches. The study. Investigators analyzed 26 randomized controlled trials, including over 1,500 patients, looking at techniques like transcranial electrical stimulation, repetitive TMS, vagus nerve stimulation, and bimodal stimulation. Results. The findings bring some much-needed clarity. For two of the most discussed modalities, transcranial direct current stimulation, TDCS, and repetitive TMS, RTMS, the pooled analysis showed a non-significant effect on tinnitus severity compared to sham treatment. In contrast, bimodal stimulation, which combines sound and electrical somatosensory stimulation, yielded consistent and clinically meaningful reductions in tinnitus severity scores, with benefits lasting up to 12 months. Adverse events for non-invasive methods were generally mild and transient. Clinical implications. This meta-analysis suggests that among the various neuromodulation techniques, bimodal stimulation currently has the strongest evidence base for providing durable relief. While other methods may hold promise, this paper tempers expectations for TDCS and RTMS based on the current body of randomized trial data. Next, we turn to a series of papers in otology and neurotology, covering genetics, surgery, and quality of life. First, from otology and neurotology, a study uses a genotype-guided approach to characterize hearing loss in adults with a common East Asian genetic variant. The study. Researchers in Taiwan recruited adults who were homozygous for the GJB2PV37I variant and compared them to genotype-negative controls. Findings. They identified a distinct audiometric phenotype. Homozygotes showed bilateral, symmetric, high-frequency predominant hearing loss. The odds of having abnormal hearing were more than 7 times higher in this group compared to controls. While tinnitus was also more common in homozygotes, after statistical adjustment, it was found to be independently associated with noise exposure, not the genotype itself. Clinical implications. This work delineates a recognizable adult phenotype for this genotype, which can guide counseling and suggest the need for longitudinal surveillance in these individuals, as the hearing loss appears to be age-dependent. Staying in the realm of hearing but shifting to intervention, another paper in otology and neurotology examines long-term functional hearing preservation in pediatric cochlear implant recipients. The study. This was a retrospective review of 113 pediatric cases at a tertiary center, all of whom had usable low-frequency hearing before implantation. The key outcome was functional hearing preservation, defined as a post-operative unaided threshold of 80 decibels or better at 250 Hz. Results. The overall probability of maintaining functional hearing was 70% at 1 year and 57% at 5 years. A critical finding was the impact of inner ear malformations. Children with an enlarged vestibular aqueduct, or EVA, had very poor outcomes, with almost no chance of preserving functional hearing beyond 2 years. In contrast, for those without EVA, the 5-year preservation rate was over 60%. The study also found that shorter electrode arrays were associated with better preservation. Clinical implications. These data are invaluable for counseling families. They confirm that long-term hearing preservation is a realistic goal for many children. but they also highlight the significant challenge posed by EVA. The findings support tailoring surgical strategy, such as electrode choice, when hearing preservation is the objective. Our final paper in this section, also from Otology and Neurotology, assesses quality of life in patients with vestibular schwannoma, based on their management strategy. The study. Using the new Mayo Clinic Vestibular Schwannoma Quality of Life Index, researchers performed a cross-sectional assessment of 652 patients managed with either observation, radiation, or microsurgery. Results. At a mean follow-up of over 6 years, there were significant and clinically meaningful differences between the groups. The observation group reported the highest quality of life, followed by the radiation group, with the microsurgery group reporting the lowest scores. The difference in global quality of life between the surgery and observation groups exceeded the threshold for a minimal important difference. Similar clinically significant differences were seen in the hearing problems domain. Clinical implications. These findings provide robust, patient-centered data to guide counseling. They quantify the quality of life impact associated with different management strategies, reinforcing that active treatment, particularly surgery, comes with a quantifiable trade-off that patients must consider. In head and neck oncology, we have important updates on screening, surgical risk stratification, and patient selection. First, a study in JAMA Otolaryngology head and neck surgery evaluates a novel antibody test for early detection of nasopharyngeal carcinoma, or NPC. This multicenter case control study from Taiwan compared a new test for antibodies against the EBV protein P85 with established markers, including EBV IgA scores and circulating EBV DNA. Results. The new P85A flat test demonstrated excellent performance, with a sensitivity of 92.5% and a specificity of 98.7%. Crucially, its sensitivity for detecting early-stage NPC was higher than the other two methods, at 93% versus 87%. This translated to a higher positive predictive value, especially in higher incidence scenarios. Clinical implications. These findings support the P85A flat test as a powerful and potentially superior biomarker for population-based screening for NPC, with a particular advantage in detecting disease at its earliest and most curable stages. Moving from screening to surgical management, a large multi-center study in head and neck quantifies the risk of cervical metastases in primary parotid gland malignancies. The study. Investigators retrospectively analyzed 380 patients from 17 centers who underwent parotidectomy with a concurrent neck dissection. Findings. Pathologically confirmed neck metastases were found in about 1/4 of patients. Level 2 was the most frequently involved station. On multivariate analysis, the two independent predictors of nodal metastasis were high histological grade and the presence of lymphovascular invasion, or LVI. For example, salivary duct carcinoma, a high-grade histology, had a nodal metastasis rate of nearly 60%. Clinical implications. This paper provides strong evidence to guide decisions about elective neck management. For patients with high-grade parotid cancers or those with LVI on pathology, the risk of occult metastasis is substantial, supporting a more aggressive, risk-adapted approach to treating the neck. Finally, in oncology, a paper from Head and Neck uses a sophisticated statistical analysis to challenge a common bias in treating glottic cancer. The study. Researchers analyzed outcomes in 676 patients treated with transoral laser microsurgery, or TOLMS. They specifically asked whether chronological age impacts cancer-specific mortality, using a competing risks model. Results. The analysis confirmed that older patients had worse overall survival. However, this was almost entirely driven by an increased risk of dying from other, non-cancer causes. When the analysis properly accounted for these competing risks, age had no significant influence on the probability of dying from laryngeal cancer. The factors that did predict cancer death were tumor-related, PT category, and margin status. Clinical implications. This is a powerful and practice-affirming finding. It provides clear evidence that treatment decisions for glottic cancer should be based on tumor biology and patient fitness, not on chronological age alone. An otherwise fit older patient should be offered the same curative intent TOLMS as a younger patient with a similar tumor. Our final section covers two key papers, one in sleep medicine and one in rhinology. First, a secondary analysis of the STAR trial, published in JAMA Otolaryngology Head and Neck Surgery, proposes a new way to think about success after hypoglossal nerve stimulation for obstructive sleep apnea. The study. Instead of focusing solely on the apnea-hypopnea index, or AHI, the authors reanalyzed the trial data looking at hypoxic burden, a measure of the total time spent with low oxygen levels. Findings. The results are striking. Hypoglossal nerve stimulation led to a median reduction in hypoxic burden of over 76%. More importantly, improvement in daytime sleepiness, as measured by the Epworth Sleepiness Scale, was significantly associated with the reduction in hypoxic burden, but not with the reduction in AHI. Perhaps most compelling, a large proportion of patients who were considered non-responders by traditional AHI criteria still achieved a transition from high to low hypoxic burden. Clinical implications. This study challenges the supremacy of the AHI as the sole metric of treatment success. It suggests that hypoxic burden may be a more physiologically relevant endpoint that better reflects patient outcomes. For clinicians managing these patients, it means that even if the post-treatment AHI is not perfect, a patient may be deriving substantial physiologic benefit that is better captured by looking at their hypoxic burden. Finally, from the airway to the sinuses, a study in the journal Rhinology provides a timely economic analysis of treatments for severe chronic rhinosinusitis with nasal polyps. The study. This analysis, from the perspective of the Spanish National Health System, compared the cost-effectiveness of endoscopic sinus surgery, or ESS, with biologic therapy. Results. In terms of effectiveness, both strategies achieved similar, significant improvements in SNOT-22 scores at 2 years. The costs, however, were dramatically different. The 2-year cost for ESS was roughly €5,300, compared to over €27,000 for biologics. This made biologics far from cost-effective in the short term. Even with a 10-year projection, biologics only began to approach accepted cost-effectiveness thresholds under assumptions of a major price reduction of around 40%. Clinical implications. This paper provides strong economic support for the current treatment paradigm. ESS is the more efficient and less costly initial strategy for most patients. While biologics are highly effective, their current price point makes them most appropriate as a second-line therapy for patients who have failed or have contraindications to surgery. If you only have time for one paper this week, make it the secondary analysis of the STAR trial in JAMA Otolaryngology Head and Neck Surgery. It argues convincingly that hypoxic burden, not just AHI, is a critical metric for assessing the success of hypoglossal nerve stimulation, and may better correlate with patient-reported outcomes like sleepiness. Here are the key takeaways from this week in otolaryngology. First, for tinnitus. Bimodal neuromodulation has the strongest evidence for consistent and durable benefit among emerging therapies, while pooled data for RTMS and TDCS are less convincing. Second, in sleep apnea patients with hypoglossal nerve stimulators, look beyond the AHI. Hypoxic burden is a crucial metric that correlates with sleepiness and may show significant improvement even in AHI non-responders. Third, in head and neck oncology, do not let chronological age dictate treatment for early glottic cancer. Base TOLMS decisions on tumor factors. And for parotid cancer, strongly consider elective neck management in patients with high-grade histology or lymphovascular invasion. Fourth, for vestibular schwannoma, new quality-of-life data show that observation is associated with the highest scores and surgery with the lowest, providing crucial data for shared decision-making. Finally, in managing severe nasal polyps, Endoscopic sinus surgery remains the most cost-effective initial strategy, with expensive biologics best reserved for refractory cases from a health system perspective. That's your roundup for this week in otolaryngology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.